You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Do you know that over 1 million people worldwide get sexually transmitted infections every day? That's a big number. Of that, it can be me, it can be you. That's why we're here to learn about sexually transmitted infections today. To our beloved viewers, welcome to yet this beautiful edition of the Doc Talk Show, which airs every Thursday on 9 p.m. This very station. So always keep it at Doc Talk Show, where we discuss health challenges and how best you can address them. This show is proudly sponsored by the Ministry of Health of the Republic of Uganda and Cameline Men's Collection. Please always give feedback, ask questions on the numbers that run below your screen. Today, I'm privileged to host two young doctors who are very, very passionate about sexual reproductive health. My name is Dr. Alex Resabula Luchams, and I'm your host tonight. I'm going to have Dr. Henry and Dr. Rogers as my panelists. I'm going to request them to use 30 seconds to greet us, our viewers, and then we start.
Well, thank you very much, Dr. Alex, and our viewers. Good evening to you all. Like rightly introduced, my name is Dr. Sechanzi Henry, and I'm super happy to be here to share about this important topic today. Thank you very much.
Thank you so much, Dr. Henry. Then Dr. Rogers.
Thank you very much, Dr. Alex. Yes, good evening, our dear viewers. My name is Dr. Rogers Senyonjo, and once again, I'm glad to be here. Thank you.
Thank you so much. To our beloved viewers, we are going to rightly delve into our discussion. And something that I want to interest ourselves in is to understand what exactly sexually transmitted infections are. Because some people just hear the word, but they don't know what exactly these infections are. And over to you, Dr. Sechanzi.
Okay, thank you very much. Now, sexually transmitted infections, as you hear the name, these are basically infections that can be transmitted sexually. You will also find terms like STDs, sexually transmitted diseases, but basically they mean the same things. So, and then some other people will put them as syndromes. Now, like here in Uganda, we have what you call syndromic management. Maybe we shall discuss it about later, but some of these, yes, we classify them as syndromes. So they're basically all these diseases, all these infections that can be transmitted from one person to another through sexual means. Now, also sexual means can go beyond the usual sexual means that we know of vaginal sex, but it could also include things like oral and anal. We know there are people out there who do this, but we shall not discuss more about this for now.
Okay, thank you so much, Dr. Henry, for that definition. Now I want us to delve into this classification, because I know if I say sexually transmitted infection, it's something that is very broad that we need maybe to discuss to our viewers so that they understand what exactly these STIs are. Despite and after knowing that they are transmitted through sexual contact, we now need to understand the exact sexually transmitted infections. So how do we classify them? How do we put them into classes? And what do we depend on to classify them?
Now, these STIs, there are quite a number of ways to classify them, but what I find more easy, maybe for our viewers out there, is to classify them based on what causes them. So most of these diseases will be caused by microorganisms. Usually, whenever you hear that it's an infection, it means that there is some agent that is coming in and is disrupting the normal physiology and the normal processes. So among the etiological agents, we have those which are bacterial. Okay, I mean, these are germs. Maybe you would say they are germs, but they are quite small germs, too small that we cannot see them with our eyes. So some of these germs could be bacterial, they could be fungal, they could be viral, or they could be parasites. I can maybe try to break these a little bit more. So in terms of sizes, usually bacteria are quite big, and some of the commonest that cause these STIs include things like Neisseria gonorrhoeae. That's one of the names of the bacteria, and as you can hear, the name gonorrhea, it causes gonorrhea. Yeah, so gonorrhea is one of the sexually transmitted diseases that we know. Then things like chlamydia trachomatis. So these are bacterial ones, and you realize that these bacterial ones are usually easier to treat. They're easier to manage compared to some of the other agents that we shall see later on. So, and there are quite a number of other bacteria. We may not really mention all of them right now, but just so that there are those which are caused by bacterial agents. Then after that, we have those which are caused by fungi. Okay, fungi are things like candida. Candida albicans. It's a fungi and it causes a disease which is called Candida. I'm sure you must have heard about Candida at least at some point. So that one is caused by a fungi. It's also more like a bacteria, maybe in size, but it's actually different. Then we also have those that are caused by protozoas. Okay, there are those which are caused by protozoas. There are quite a number of protozoa agents that can as well cause sexually transmitted infections, as well as those which are viral. Now, the viral ones are usually very small. Viruses are very, very small. I think if you compare bacteria and fungi and the parasites, yes, you realize the viruses are the very, 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 very smallest, but all of them are small, but you can't even see these with our eyes. So viruses, there are quite a number of them. HIV itself is a sexually transmitted infection, because you all know one of the commonest ways, or the most route by which HIV is transmitted is through sexual contact. Then there are things like HPV. Okay, these ones which will cause some of them can even cause cervical cancer. Okay, so HPV has been implicated in causing cervical cancer. So basically, those are the main causes of these sexually transmitted diseases.
Okay, thank you so much, Dr. Henley, for that clarification. Dr. Rogers, I'll get back to you. Do we have any of these sexually transmitted infections being transmitted from one person to another because of hygiene issues? Because we've had so many instances where we get clients or we get patients, you find that they have sexually transmitted infections and they claim that maybe they got them from places or from washrooms. So are these is it only through sexual contact, or there could be other means?
Okay, thank you very much,
transmission?
Dr. Alex. Now, just the way the name says, sexually transmitted infections, they are primarily transmitted through sexual contact. That is primarily transmitted through sexual contact, but that doesn't mean that is the only mode of transmission. Okay, let me give you an example. When a mother is giving birth, for example, and she's having untreated gonorrhea, she can actually pass on this gonorrhea to the baby that is being delivered at that point. Mothers who have been pregnant, they know that during antenatal, it is a must to screen you for things like syphilis,
yes,
because it can be passed down to the unborn baby. Okay, yeah. So it's not just through sex, but there are other means. We've talked about things like HIV, hepatitis B. This can actually be transmitted through maybe blood exchange. Maybe you've used an injection and it shares the same. Yes, you've talked about accidents.
Yes.
Yeah, so they can all come in to bring this. And then still, you've talked about hygiene issues. Yes, it is very, very true that someone can get an infection through the hygiene issues. Let me give you an example. If you're using a bathroom where someone is coming from, and this person actually had an infection, let me use, for example, had chlamydia, okay? And they didn't do well. They didn't do well with hygiene, and maybe the place is still wet. The urine maybe is still stained somewhere, and then you come in. There can be this splashback, as perhaps of the urine, whatever is there, and you end up getting an infection. However, this can easily now be transmitted to the other person, maybe your partner, through sex. Yeah, yeah. So you're getting it from the bathroom, but you can actually go on to be transmitted through sex. And then he has talked about things like candida, for example. Now, candida, you can actually get it without having any sexual contact.
Sexual contact, yes.
Just be that your immunity has weakened. Okay. There's some things like bacterial vaginosis. It's a condition where we're having an infection in the vagina, and it comes in when the normal flora, that's the normal bacteria that is supposed to be in the vagina, that normal environment is interfered with. Okay, you can actually end up getting these other abnormal infections coming in. They're able to colonize, and of course, when your partner comes to meet with you, they're definitely going to carry on this maybe to the next person.
Because actually, bacterial vaginosis has now been proven to be sexually transmitted. Initially, it was not, but now it has been proven through research that it can be transmitted from one lady to the other if they have one sexual partner who is a male.
And maybe one other thing we need to know is that STIs and UTIs are different.
Yes.
Many people tend to take these to be the same, thinking that, actually most of the people will confuse that too. Okay, but I want our viewers to know that a sexually transmitted infection is different from a UTI, urinary tract infection. Usually, I think the dilemma comes in is that usually these are the same organs. Okay, especially for males, is that this same urethra that you use to pass urine is the same, is in the same organ that your sexual organ. Even for the females, the urethra is not very far away from the main sexual organ. So these are quite different, and it's always incumbent upon you to go to healthcare worker, explain to them. For them, they know, they can be able to tell that maybe this is an STI, this one is a UTI, and they manage accordingly.
Yeah.
Thank you so much, doctors. I request us to use likely 1 or 2 minutes before we go for a short commercial break to briefly talk about the epidemiology, or how big is this problem. In just a minute, how big is this problem of STIs in our communities where we live?
Dr. Alex, this is actually a very huge problem. Yeah. Where I work, in a setting where I work, at the clinic where I work, every single day I receive about 10 ladies on average. It could be less or low, but on average 10 who come in and they're complaining about maybe an abdominal discharge, okay? Complaining about maybe low abdominal pain, who come in complaining about genital itching, or even sores sometimes. So this can just show you, just from that, without even mentioning the figures, just from that picture, that it's a very common challenge. You already told us from the global picture,
Perspective.
that every single day, over 1 million new STI infections, new STIs are acquired. Okay, and this, of course, it's combining everything. But when you try to break it down, for example, syphilis alone, in 2022, let me use that example. 2022, over 80 million syphilis infections, only syphilis, were acquired. Okay, that just shows how big the problem is. And what is surprising, it is previously it used to be mostly among the young people, the adolescents. Of course, it is still high among the young people because most of them are just starting to get sexually active. They are not well empowered, and they end up actually messing up. But also right now, we are seeing it so much now in the married couples. And the question is why? So maybe that is for the viewers to answer.
Actually, maybe to add on that about epidemiology, most of the people who have these STIs are aged between 15 to 24 years. That means they're quite young.
Those are the young people.
Yes,
They're the
and
most
the
sexually
problem
active.
is mostly in sub-Saharan Africa and in low and middle income countries. Maybe if we have more time, we can discuss about why is it more in low and middle income countries.
Okay, thank you so much for that discussion. I request that we first go for a very short commercial break, and when we return, we shall delve deep into the reason as to why they are more common in that age group that we've talked about, and the sub-Saharan Africa or sub-Saharan area of Africa. Let's go for a short commercial break. When we return, we shall be right back to continue with the discussion. Thank you.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying, and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
You are watching the DOCTALK Show.
This message is from the Ministry of Health with support from partners.
Our dear viewers, welcome back from that short commercial break. This show is proudly sponsored by the Ministry of Health of the Republic of Uganda and Cameline Men's Collection. Please follow us on our different social media platforms and give us feedback on the number that runs down your screen. As we are going to the short commercial break, we are discussing the reasons as to why this disease is commonest in Africa and specifically sub-Saharan Africa. And I request Dr. Chance to come in and give us the reasons, that reason.
Okay, thank you very much. So now, I realize that here in sub-Saharan Africa, our sexual education is quite lacking. I think it's because of our social, our religious and cultural factors. Is that
Cultural beliefs and religious
in that,
beliefs.
talking about sex here in Africa, it's something that's not quite common. Parents rarely talk to their children about it. So, and the reality has come to show us that even if they don't talk about it, somehow the children find the information. But usually they find the information
Wrong
in the wrong
information.
way
The wrong
and from the wrong
Or
people.
inappropriate, depending on
Yes,
their
yes.
age.
Yeah, for instance, we always encourage people to abstain. Okay, that is what science will tell you. That's what most religions will tell you. But the reality gets to be different in that, much as yes, that's what you want, but it doesn't happen. So, because of this, many of the children out there, they don't know what to do and they find themselves making a mistake. So by the time usually they come to us, it's quite late. So I feel like we need to improve on our sexual education as a whole of Africa and Uganda in particular, so that we sort of try to reduce on this burden. But of course, there are quite a number of other reasons as to why this problem is quite common here in our setting. Of course, things like poverty, they further compound it. Many of the young children will be lured into early sexual debate at quite an early age. I don't know if Dr. Rogers wants to add on that.
No, basically, it is mostly this our socioeconomic status in sub-Saharan Africa. It is still very, very poor. We are very poor.
Plus all levels of education.
Yeah, all those things come into the picture. Yeah, so basically, it's relating around that as to why it is high in this.
Okay.
region.
Thank you so much, Dr. Rogers and Dr. Henry. So now we are going to talk about the risk factors. If I'm residing in an area that you talked about that has a very high prevalence, what puts me at risk of getting these STIs? I'll go with Dr. Rogers first.
Okay, thank you, Dr. Alex. Now, I don't know what your experience is, Dr. Sechans, but from my interaction with the people who have had these STIs, it is actually sexual behaviors, what we call risky sexual behaviors. That is the main risk factor that is responsible for this. And of course, someone might ask, what are the risky sexual behaviors? Because people might not know. It's talked about our education levels and the sexual education, they are very down. So some of the sexual behaviors, one, anyone who is having unprotected sexual intercourse is actually at a risk. Whether you're faithful, because you don't know if your partner
Is also
is
faithful.
Yeah,
To
so
you.
as long as you're sexually active, you're actually at the risk of having an
These
STI.
STIs.
Okay, and that's why we recommend protective measures, definitely. And if you're someone who has multiple sexual partners, you're definitely at a risk.
At a higher risk,
At a
actually.
higher risk of
To put
actually,
it
it's
right.
a higher risk of having an STI. I mean, since you have multiple, maybe the other person also has multiple,
yes.
and it just
It's true.
more of a chain of partners.
They call it a sexual network.
Exactly. So in social
Having a rich
network,
sexual network.
and also, of course, there are some behaviors that especially young people have. For example, let me say drinking alcohol. Now, I'm saying drinking alcohol, but I want to put in the context of risky drinking of alcohol. Yeah, because we all drink alcohol at
Yes.
one point, I know. But you find young people going into groups and they drink themselves and out, they lose their reasoning, they make irrational decisions. I had a client who came in, sorry for saying this, I know he's not watching, but they actually ended up blacking out when they were partying, and the morning they found condoms, not condoms everywhere,
Used
but they're not
condoms.
sure if they were used or not. Okay,
Whether they were used on them or not as
Yes.
well. Yeah.
Or not. Yeah. So but they don't know what happened. So those are the risky behaviors we're actually talking about.
And
Okay?
usually you're not sure whether this person used these condoms correctly and consistently. Because
Exactly.
at times people that come with signs and symptoms which are suggestive of STIs, usually when you ask them whether they're using condoms or not, one of the things that will tell you, we are using condoms. How are you using them? They are usually using them on the first sexual encounter or the first round. Then from the second round and onwards, it's always meat on meat, as youths usually say. So the sexual behaviors, as you said, also determine because people at times can report to be using the correct sexual behaviors or the protective sexual behaviors, but they're not using them correctly and consistently. I think I'll go to Dr. Sachans to tell us other risk factors to these sexually transmitted infections. Over to you, Dr. Sachans.
Okay, so Dr. Rogers has given us an example of that client who was partying and they found used condoms. So of course, if these condoms are used on this person, ideally that's not appropriate. So we encourage that whatever activities you engage in, they have to be consented. They have to be consented. So that one would probably be treated as a sexual assault.
True.
So things like sexual assault actually put people at a
At a
risk,
risk.
because this person who is assaulting the other could be having an infection.
STI.
Even the person actually who is assaulting could actually go without an STI
And picks it from
there.
the person that he or she has assaulted.
So things like a sexual assault could actually put someone at a risk. And then also, if there's anything that can weaken your immunity, we all know that patients who have, for instance, diseases like diabetes, those who are using certain medication that weaken your immunity, those who are on cancer drugs, some of these conditions could actually weaken the immunity. And because of that,
People living with HIV as
yeah,
well,
yeah,
they are
yes,
also
yes.
at an increased
Yeah.
risk
So because
of
of
immunity.
that, these genital organs, they sometimes have microorganisms that keep them safe. We call them normal flora. But then, if your immunity is weakened, some of these actually could become dangerous, or any exposure could actually put you at a risk. So there are quite a number of other things which could really put people at risk of these STIs, and it's always important to look out for them and you prevent them.
And Dr. Chance, one more thing. One of the things that are becoming so common in our setting are the number of people engaging in commercial sex. Commercial sex. There are many massage parlors which are everywhere. Previously, it used to be those people on the streets, but now they have been modernized, whereby you can go in a safe place, a safe space where no one will suspect you, and the rates at which infections are being spread in that area is also very high.
They usually have that component called the happy ending.
I don't know about that.
If because we said it is STIs are spread through sexual contact, and so if you're talking about massage parlors, of course, I've never been there, but I've had experiences of people that have been there. That usually there is what you call the happy ending. Anyway, it's a wonderful discussion here, and right now I want us to delve into the signs and symptoms. How do I suspect that maybe I have an STI? Because literally, one of the things or one of the core components that we always look at as DOCTALK show is to empower people with information so that they can know that maybe I'm at risk or I have this disease. So I request that we delve deep into how do I suspect that maybe depending on the signs that I have, likely I have sexually transmitted infections. I'll go with Dr. Sachans first.
Okay, thank you very much, Dr. Alex. Now I'll start with the most common symptom. That is a discharge. This could be there for both males and females. And actually, in places where they're doing syndromic management, we have what you call abnormal discharge syndrome. Okay, abnormal urethral discharge syndrome, abnormal vaginal discharge syndrome. So usually one of the symptoms that patients will come with is that abnormal discharge. Yes, of course, when we say abnormal, it means it's a normal one, and a normal one it is one whereby one, it's not too much, like the quantities are usually not too much. Two, it's not foul smelling. Three, it's not itching. So a discharge that doesn't follow those characteristics is likely to be abnormal. So usually an abnormal discharge is going to be too much discharge. Two, usually it's going to be foul smelling. It's going to be
The color
itself, it changes.
Number
one is usually colorless to white, but this one usually the colors can actually change. And so these abnormal discharges could be for males, it could be urethral discharge. So you can actually see this at the tip of your genital organ, or even you could find that your panties
They're stained.
they're stained. So that can be one of the signs. And then for females also, the discharges are quite common in females, which are not normal. And for them usually they'll itch them, they'll be foul smelling, and there will be too much discharge. So discharge is one of the symptoms, and whenever you have it, it's always good that you be assessed by healthcare worker. Yes.
Over to you, Dr. Rogers.
Okay, thank you, Dr. Alex and Dr. Chechans. I think I want to first put across, before I actually bring in other symptoms, is that some of these infections are asymptomatic. You will actually have an infection without having any symptoms, and you're wondering how. I mean, some people come, you test them, and you're like, you have this, and someone doesn't have any symptoms. It is very possible. Perhaps your body is still trying to
fight against this infection,
but you're actually spreading it to the next person, and this person will actually have symptoms. They will be affected. Yeah.
Actually, yeah. So Dr. Dodge, just about that. Realize that even these symptoms will not manifest the same in males and females.
True.
You may find that a man and a female have the same STI, but the symptomatology is different.
different.
Very,
One of
very
them is not having any symptoms, the other is having symptoms.
Exactly.
So this one where symptoms can always spread to others, and you can actually get the symptoms.
Yes, but then about this, the symptoms, of course, there are different specific symptoms, but for the purpose of this, I think it's better to highlight them generally. So the health worker will be in charge of knowing which exact
STI you
STI you
have.
are dealing with. Yes, talking about the discharges. Let me say, if you're a woman and you're having gentle itching, okay, that is a sign. In case that's a symptom. In case you're having an abdominal rash, okay, the rash could be in the private parts, or it could be all over the body. Yeah, it could also indicate that you're having an infection going on. In case you're having some pain during the intercourse, yes, it could indicate that there is an infection that is going on. And of course, there are other non-specific symptoms that could come in. You can get a fever.
Because you have an infection
Yes.
going on, so the
Yes.
body is trying to fight.
Exactly.
So you end up with a fever.
They're what we call lymph nodes. They're found in different parts. Even in this region, down, they are there. I don't know, we might not be able to illustrate it here, but if you can have those lymph nodes, they can become swollen, okay? And sometimes if they're too big, you can even feel them yourself as a patient when you're touching there. And you can, in your growing area, it could indicate that you're having something going on.
Thank you so much, Dr. Rogers and Dr. Henry, for taking us through the signs and symptoms as well as the risk factors. I've actually just known that your sexual network may be as much bigger than what you actually think. You may end up having a sex network of around 30 people, and for you think you're only with only one person. So we really need to be very meticulous of our sexual networks so that we don't get these sexually transmitted infections. And if you see any risk, please run away. Thank you so much for keeping it at the Doc Talk Show. We are going to go for a short commercial break, and when we return, we shall look at how best you can manage these sexually transmitted infections. Thank you.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. As we went into that short commercial break, we are discussing the presentation of sexually transmitted infections. What can trigger your mind to know that maybe I have sexually transmitted infections? And in this segment, we are going to finish up with the discussion of what can trigger you to know that maybe I have sexually transmitted infections, and then we shall proceed. Over to you, Dr. Rogers.
Thank you, Dr. Alex. Now, in addition to what we've talked about before we went for a short break, some people might actually experience pain or some discomfort when they are passing urine. Okay, some people experience burning sensation when they are passing urine. Others just feel some bit of itching within their genital organs. But yeah, it could also mean that you're having something wrong going on. And then one more presentation that I want to talk about is they are the sores or the ulcers. This could be in your private parts, and they are common for almost every.
They're like wounds.
Yes,
like
they are
wounds.
wounds. They are wounds. So for like syphilis, for like there are other genital ulcer diseases, even warts. You know genital warts.
Yes.
Yes, they could also mean that there's something going on. If you're a woman and you start experiencing some bit of abnormal bleeding, it could mean your cervix could be having something wrong that is going on. So it could also indicate something. And then lastly, lower abdominal pain. You see, when you get this STI, they have a tendency of moving upwards. They go into your pelvic organ.
Because it is an open kind of.
So they can go into your uterus, tubes, and the rest. And they will actually cause that pain that you feel, the sensation. So my advice usually is the moment you feel something that is a bit abnormal about your body, just go and have a routine check. Just go and have a check done. Just have that urine taken, that vaginal swab taken, and you have a test done to rule out any possibilities.
Okay, thank you so much, Dr. Rogers. Maybe to add on something small concerning the signs and symptoms. Usually, as the health workers, when we trying to talk to these patients to know what exactly the problem could be. There's what we call the 5 P's that are specific for STIs, because at times you may feel uncomfortable that maybe your doctor is asking a lot. But among the things that we always look at is your partners, the number of sexual partners that you have. So the first tip is always partners. How many sexual partners that you have? Do you know their sexual partners? Because someone could be there and they know that I have a sexual partner who has other sexual partners. Then we also look at the practices, sexual practices, because you know that there are some practices, as we have said, that may put you at risk of getting these STIs. Then the others, especially for the ladies, like we said, that there are some infections that can be transmitted from the mother to the child. So we always look out for if this woman is having an active infection that is potentially transmissible from the mother to the child, how best do we prevent it? So the prevention of the pregnancy during that process of an active infection, and then the prior history of STIs. Because, like we said, if I have ever had an STI before, likely I'm also going to be at risk of getting another STI. And then the last one is the prevention of the STIs. So always these doctors will have a comprehensive discussion. We have had patients complaining. This doctor has asked me about, my husband, and we are trying to find out what could put you at risk and how best you can actually avoid them. So we are going to now go on with our discussion. Basically, we want to discuss the testing and what challenges are faced in the testing. Because after these patients having these symptoms, they always rush to health facilities to be tested and find out. So how do we test for these sexually transmitted infections, and what are some of the challenges that we face in testing for these sexually transmitted infections? Over to Dr. Sechanzi.
Okay, thank you very much, Dr. Resavula. Now, for us want to know that a patient has an STI or an STD, we start by taking their history. Okay, they'll tell us how their symptoms have been, like we mentioned about the symptoms, the discharges, the low abdominal pain, the fever, so we will start from that. Sometimes we may need to examine them. For instance, we may need to see actually if actually the discharge is there or not. Okay, sometimes we may need to do some examination of the genital of the private parts of the patient, and of course, if it's a female patient and you're a doctor, we always want that there is someone besides you, especially female, to act as a chaperone to ensure that all is well. Of course, this is good for medical legal purposes. So we examine you, and of course, usually from history alone and the examination, you can always be able to tell that maybe this is it, this is not it. However, sometimes you can actually go an extra mile and you do some tests. However, for STIs, we've not for so long, we've not had many tests that we do actually for sexually transmitted diseases because most of these tests have not been available in our settings. But of course, our friends in the West, most of them have the tests. So the tests like what you call the nucleic acid amplification tests. Okay, this is a NAT test. This test looks for the DNA or the genetic material of the organisms
that is causing this STI.
Yeah. So for conditions like gonorrhea and chlamydia, usually this is one of the tests that is done, that is recommended to actually make a diagnosis. However, sometimes we don't even need all these tests. There's what we call syndromic management, in that when you compile all the patient's symptoms, as doctors, we can be able to tell that actually the problem is this, and we may still go ahead and institute treatment even without doing those tests. So the point is, most of the time the diagnoses are made clinically from what the patient tells us, from what we find on examining them. But sometimes where possible, we go ahead and do some tests. Of course, apart from that nucleic acid amplification tests I mentioned about, there are also things we can do, like we can check your urine. Of course, be aware that UTI is not equal to STI, but sometimes there's so much information that we can get from the urine alone. Okay, we can do some urine analysis, we can do some blood work, and with all these, we can be able to tell where the problem is and manage accordingly.
And Dr. Sechanzi, actually for the ladies also, we do what we call a hair vaginal swab. So a hair vaginal swab is we go and pick the sample from your vagina, okay, and we take it to the lab. So we're able to view under microscope, and we're able to do some more tests, about gram staining and all that, to try and classify which kind of infection or which kind of bacteria or microorganism is causing this infection. So actually for the ladies, most times we recommend doing a high vaginal swab for the STIs. And for the gentlemen, we can continue with the urine because it's the same system. Yes, but usually lady asks so much, why are you doing this vaginal swab? It's actually very important. And it's my preferred test for screening routinely.
Okay, thank you so much. And like we said, there are other testing modalities, because what ministry usually does is to screen the high risk people people that are high risk of getting these sexually transmitted infections. There are strips that we know that are were approved to be used to screen some of these sexually transmitted infections. For example, if we talk about syphilis, if you talk about hepatitis B, because you know hepatitis B can also be sexually transmitted, and even HIV. So some of them can actually be tested using these strips that we always use to screen for most of the conditions. And for those that are found positive, we always referred so that they get the confirmatory tests and if maybe be rolled to care if they are actually
we
found to be
also have
positive.
strips for gonorrhea. They are more of screening still, but we have gonorrhea RDTs, we have chlamydia RDTs. So there has been some bit of improvement, advancements in the diagnostics. Yeah, so we're not yet there, like you said, but I think we are getting there.
My panelists, one of the things that we talked about that the reasons as to why we have this very high incidence of STIs is the challenges that we face in testing. So I want us to discuss those challenges and find maybe solutions for them. Why exactly are people not coming for routine, screening and testing for these sexually transmitted infections? What can be done?
Okay. Very important question. To start with, I would say there's a bit of stigma about these STIs. Whoever has an STI doesn't feel free to reveal it or to open up that actually they have it. And actually, from my experience, when we see patients in the clinics, a patient will come to you and they'll tell you all their problems except the ones that are sex related. So it's only when they are going and they're leaving home, they're leaving your door that will say, "Hey, doctor,
maybe
one other
something
thing
more that I've forgotten.
one other thing I forgot to mention.
That's very
I
important.
also have such and such a problem." So our people should know that actually these are realities of life, and if only we can try to know that doctors are understanding people, they know the things, and we can trust them with the information. That can be very important. That said, our sexual education is still low. We don't have most of our young ones taught about these things early enough. So usually by the time they get this appropriate information, most of the times it's late. Of course, these problems are compounded by all the other social, cultural problems, the low literacy rates, the low the high poverty levels sometimes, and many of these problems together compound it and make it much more of a challenge. And of course, also to mention that sometimes the services are not as fully available in most of our settings. Sometimes the facilities are not easy to access. Sometimes the facility factors and individual factors. So all these further compound the problem.
Actually, something that is very important is, when you're talking about young people should be handled in a special way, right? So we usually recommend facilities to have what we call youth-friendly corners
or youth-friendly services.
Youth-friendly services where a young person can go and freely opens up to the health worker. But you find that especially in the public facilities, the person that is handling this young person is someone who is maybe of 50 years. This young person will look at this health worker as a mother, and they will even be afraid of opening up. And then you find this young person is lining up in the same line with adults and mature people. So they get scared of all those things. Civil society organizations have tried to establish youth-friendly services and corners in public facilities. The challenge is, once the projects that we are funding, such initiatives end, even these innovations that have been put in place,
they die away.
They die out. So we need to have also a little bit of sustainability beyond the project, so that we can have young people easily access this.
So at least we should have young people working on young people.
Exactly.
There's a saying that I always said, yes, exactly that, young people for young people, because there's a belief that young people understand their problems much more or much better than the old ones. They may not be experiencing the same problems, they may not be having the same exposures, so that gives a deficit in terms of access to care and access to these testing and treatment services.
That's why we're having things like peer educators, so that they can
peer educators, peer supporters. In most of the institutions, they have been given different names. Peer buddies. You find that at least you can easily open up to your friend, other than opening up to someone, your age mate, your friend, other than opening up to someone who is maybe 20, 30 years older than you. Thank you so much, our beloved viewers, for keeping it only at the DOCTALK show. We are going for a short commercial break, but just to remind you, this show is proudly sponsored by the Ministry of Health of the Republic of Uganda and Cameline Men's Collection. Kindly follow us on our different social media platforms and give us any feedback on the lines that roll down your screen. Thank you.
You are watching the DOCTALK show.
This message is from the Ministry of Health with support from partners.
Crafted with precision, designed for brilliance, Supreme Wave pens reach the hands that shape tomorrow. Only a Supreme Wave delivers expression this pure. In every stroke, confidence flows. Because greatness isn't guessed, it's written. Supreme Wave, write your future.
You are watching the DOCTALK show.
This message is from the Ministry of Health with support from partners.
Thank you so much, our beloved viewers, for keeping it only at DOCTALK show. In this episode of the DOCTALK show, we are discussing sexually transmitted infections, which are very prevalent among the sexually active youth. And before we went to the short commercial break, we are discussing how best these STIs are found out or how they are tested. And right now we want to know if I know that I have an STI, how am I managed? How do health workers manage these STIs in hospital settings? So let's go to management. Over to you, Dr. Sechanze.
Okay, so after a diagnosis has been made, they have taken your history, they have examined, they have run some tests. Sometimes they've just built a syndromic approach whereby we just based on the symptoms, and we can know what you're suffering from. So after I've made our diagnosis that maybe this patient has gonorrhea, or this patient has bacterial vaginosis, or this patient has hepatitis or HIV, because those are also sexually transmitted, we manage according to what we have found or what we think is a problem. So management, we shall give you some medication, of course, plus some counseling on how you're going to take the medication and how to prevent some of these from recurring. But basically, for medical management, usually we do tablets, we capsules. Sometimes we can actually give you injections, and sometimes these drugs, the management is phased in that we shall have a first line, okay, of treatment. Sometimes that first line may not work. Okay, sometimes it could work, but partially, and you don't get full resolution. So our guidelines even provide for that, in case a patient has been started with such and such a drug that is recommended, and maybe they don't have full resolution of symptoms, what more can we do? There's a second line of drugs which can be given, even a third line. Okay, so that's why I usually always tell my patients, the patient can come and tell you, hey doctor, I have such and such a problem, we have treated it, this medication finished, I got some simple relief, I treated again, and sometimes they're actually using the same medication. Okay, that's why at some point we need a specialist to further look and analyze and see what has been done, which medication have been used, so that maybe they know the second line of treatment that can be used. So they are usually it's graded in lines, phases. So you can have a first phase of treatment. If it fails, there's always another phase that can be treated. But usually most people improve even with the first treatment that is given. So sometimes, as I said, it can be tablets, but we can as well advance and give you injections, which could either be into the muscle, that's intramuscular, or intravenous. Then, of course, the viral ones usually are quite difficult to treat. Viral ones, actually, most of the viral sexually transmitted diseases are ones that you may not treat for recovery. Like we mentioned, HIV,
but we just manage them.
Yes. Like we mentioned, HIV is one of the sexually transmitted diseases, and we all know how HIV is managed. Okay, sometimes drugs like hepatitis, there's a way they're supposed to be managed. So we manage according to what you found to be the problem.
Thank you so much, Dr. Sechanze. There's something that I want us to interest our viewers on, and that's the pattern of taking these medications. Because most of the times you find that maybe if there's on try they give it as a first line because likely it is much more efficacious or it works better than these other lines, and we want to try it first. People usually take these drugs maybe for 2 weeks, 10 days. Someone is prescribed these drugs for 10 days. They take it for only like 3 days and then they get relief and then they stop taking the drug. So I want us to interest our viewers in what exactly is that. So should they stop immediately they get the relief of the symptoms?
Definitely not. And actually, when you do that, you've caused much more trouble. In that, these days we're having what you call antibiotic resistance. In that, if you have this bacteria in your body and you expose it to suboptimal amounts of a drug, and this bacteria, of course, some of the bacteria will die, but some of them will survive. Now, these ones which have survived will now know that actually there's such and such a threat, so they try to prepare defense mechanisms so that next time you apply the same drug, there'll be
It's
some
not
resistance.
working.
And maybe the other important thing I wanted to mention about is that the paternal notification as well as treatment. So if you have an STI and you treated, but your partner who probably gave it to you or whom you gave it to is not treated, even after you get your symptoms relieved and you go back to that partner, you're going to pick that same bag. So it's always important that the moment a diagnosis has been made, you disclose to your partner, and doctors can always advise on what can be done to ensure that the person also receives treatment. Otherwise, STIs are not conditions that you just treat one person
And you leave
Yes.
the sexual partner. Thank you so much, Dr. Sachans. Dr. Rogers, do you have anything to add on treatment?
Just on what he has said, there's a tendency of patients, if you give them medicine and then they improve on that medicine, the next time they get the same symptoms, they won't even bother coming back to you. They'll just go to a pharmacy
And just buy.
the similar drugs you gave them. And then that will contribute to what is talked about, that microbial resistance. Because this time around, maybe the infection you're having is different from what you had previously. Yeah, so you need to be very careful. And also sharing of drugs, of course. Some people take them, like you said, someone takes for 3 days, gets better. Maybe the infection is now in the entire home. And now she shares with the husband, and the husband takes. We are taking of suboptimal doses, okay? And we're actually predisposing ourselves to resistance. But basically, the management, like he has said, it is basically medical, but of course it comes handy with the supportive care through counseling and the other things. Yeah, thank you.
Thank you so much, Dr. Rogers. Right now, for that wonderful discussion, right now I want us to interest our viewers in the complications. If I have these STIs, what could be the result? What are the things that can come out of these sexually transmitted infections? Over to you.
The complications of STIs. You know, the funny bit is about the anatomy, where these STIs are actually affecting. So they are basically affecting our reproductive system. Okay, they are, of course, if you're a woman, it's going to enter through your private parts and can enter to the uterus, can move on to the tubes, and of course, even the ovaries sometimes. So what is going to happen is most of the clients we've seen who come with infertility. Okay, you will find that they're having maybe tubal blockage. Their fallopian tubes are blocked. And when you go ahead to investigate or to inquire, take more history, you find they have had an history of an STI before, a sexually transmitted infection before. So one of the most common complications that we actually get are issues to do with fertility. This cuts across both in the men and the women, because even in the men, we can have this, you know what happens is when the infection enters, it causes damage on your tubes, your organs in there. And when the damage is made, in the process of healing, sometimes there forms what we call adhesions or scars. And then they obstruct the normal flow of the sperms and the movement of the egg for the woman. Okay, you're going to end up having what we call secondary infertility because of this. Yeah, but of course there are other complications depending on your condition at that moment. For example, if you're pregnant and you get an infection, the risk of having a miscarriage is very high. Okay, that's why you see when you're pregnant, they will do a urinalysis as a routine test that must be done just to make sure that you're okay, because UTIs, for example, can cause most of these miscarriages. Okay, and many other complications. Maybe Dr. Sachans can add on.
Well, you've told us about a pregnancy. So if someone is pregnant and they are having an STI, of course this STI can ascend. Can ascend through the birth canal. It could get to the cervix, almost up to the uterus. sometimes these STIs could contribute to some of the anomalies that we see in the children. Okay, so some of the birth defects that children are born with, actually they come because they were exposed to some of these agents or their toxins while they were still in utero. So these anomalies could affect any part of the body. It could be the bones, it could be the head, it could be the heart, or any other part of the body. So for that reason, the patients who have had these STIs, their children tend to have bad outcomes. But apart from that, these STIs can actually affect the children as well themselves, because like we all know, things like HIV can actually be passed on to the baby by vertical transmission. Things like hepatitis B, syphilis. So imagine a baby is born and you're already having syphilis.
Sure.
You're already having these. Actually, there's some conditions which you call the torches. Things like toxoplasmosis. You know, and public may not get them. But basically, I want our public to know that there are quite a number of conditions that if a mother has, and they can actually pass them on to the baby.
to the
And
unborn baby.
yeah, so if we can prevent this, the best. Maybe I'll end with this one. That some of these STIs can actually put people at risk of some cancers. I'll mention an example of HPV, which is human papilloma virus. It has been implicated in cervical cancer. Yes, so
Even penile cancer
yes,
for the men.
yes.
Yeah.
So you realize that it's not just about STIs. It actually goes beyond that, and all know what cancer can do. Quite difficult to treat. Usually has bad outcomes. So we all have to address this problem of STIs with all our might.
And I think we should also use this opportunity to also educate the masses that usually in when we are vaccinating people against HPV, in order to reduce them on the risk of getting cervical cancer, we are always looking out for people that have not yet engaged in sexual activities. So if you've not yet engaged in sexual activities, please go, and you're a female, go and get vaccinated against human papilloma virus so that you reduce the risk. Maybe some other complication that Dr. Sachans and Dr. Rogers have not talked about is the risk of getting neurological damage or neurological deficits, especially when we talk about syphilis, because we know that syphilis, as it progresses, most of the times ends up affecting nearly all the organs in the body, and one of them is actually our brain. So we can end up with neurological damage because of syphilis, which is a sexually transmitted infection, meaning that it's our onus to really prevent them. I request because our time is really fast spent, I request each of our panelists to give us some parting shots, at least something that our viewers can take from this talk show that we've had.
Thank you very much, Dr. Alex, and our viewers for keeping it here. My parting shots basically are going to be on in 30 seconds. If you can avoid getting a sexually transmitted infection, please do avoid it. In primary and secondary, they teach us about ABC. Abstain. If you can't abstain, be faithful. If you can't be faithful, use a condom. Okay, so try as much as possible. This information is widely available to avoid getting this infection because you've heard about the complications. If you are to use a condom, please make sure it is used correctly and consistently.
Yes.
And there is no, if you have multiple sexual partners, please make sure that you're protected at all times. But of course, have one person, and you can live a good life with one person. Otherwise, thank you very much, and I hand over back to you.
Okay, thank you so much, Dr. Rogers. Over to Dr. Sechanzi.
Thank you very much. So for me, I want to tell you, our people, that STIs are here with us, but they're not the only problem. STIs, HIV, teenage pregnancies, and many other problems are all here with us. And some of these problems are compounded by low education levels, sometimes poverty levels, and many other social factors. So, of course, plus our cultural and religious beliefs, which I believe some of them we might need to get over addressing them so that we solve some of these problems that are having a huge toll on our community. Thank you very much for being part of this. I hope you had something to learn.
Thank you so much, our panelists, for coming through to sensitize the masses about sexually transmitted infections. And thank you, our viewers, for keeping it only at DOCTALK Show. Thank you, our sponsors, that is Ministry of Health of the Republic of Uganda and Cameline Men's Collection. Thank you so much. Have a good time. See you over the next episode.
This message is from the Ministry of Health with support from partners.